All right. My name is Aruna Arora. I'm the president of the Medical Association of the State of Alabama. And we are here today to present some experts here to talk to us about the current COVID situation that we're in. We're not obviously thrilled to be having this discussion, but we feel that it is right for the public, all the members of Alabama to be tuning in and to be hearing this information. So I want to welcome our two guests. We have Dr. Scott Harris, who is our state health officer. And then we have Dr. David Kimberlin, who is our pediatric infectious disease expert in our state at University of Alabama, Children's of Alabama. So welcome to both of you. I'm going to go ahead and let Dr. Harris, if you want to give us a brief update, and then we can start with some questions.
Sure, I'll be glad to. Thanks very much, Dr. Arora. It's good to see you again. Dr. Kimberlin, it's great to have you with us today too. We are very glad to be able to do this. This is going to be at least a weekly event that we can live stream here on Facebook for providers, but also for the public or the press or anyone else who would like to participate. So I really appreciate you guys including me. Just to let you know, we've had a very difficult couple of weeks here in Alabama with regards to COVID. I think we got lulled into a false sense of security in the month of June. We weren't detecting a lot of cases, but nationwide since the first part of July, the Delta variant seems to be responsible for increased numbers in virtually all of the United States. Certainly the vast majority of US states have case numbers on the rise. We certainly have seen that in Alabama as well. That's been reflected, first of all, in our daily case rates. We had through most of May and most of June around a couple of hundred cases a day that were reported to us, maybe 240, 250 cases per day. That was one of the lowest numbers we'd seen really since the very beginning of the pandemic, almost a year and a half ago. Starting around the first part of July is when we started seeing numbers creep up. We've actually had well over 1,000 cases a day for the past 8 or 9 days. In fact, greater than 2,500 cases a day for the last 3 days. That's really concerning to us. Those numbers have accelerated so quickly. That's been reflected now in the numbers of patients we see in Alabama hospitals. I will tell you, we have always seen this sort of lagging indicator of having case numbers go up, and then a week or two later we see hospital numbers go up, and then sad to say a week or two later we see numbers of deaths go up. So we are now seeing hospital numbers go up with a curve that almost looks exponential. It's going up at a much faster rate than we saw even back in December and January when our numbers were so difficult. On the July 4th weekend, we had about 180 people around the state who were hospitalized with COVID. That's in every hospital combined. As of this morning, we're right under 1,200 people hospitalized around the state. So actually about 3.5 weeks later, we've increased 5-fold. And that's a rate that's even faster than what we saw back in the winter. 1,200 patients is something our Alabama hospitals can manage. They can handle that number. We had much higher numbers back in January where we were over 3,000 inpatients at some point. But the rate at which these numbers are going up is unprecedented. We have not seen it before. And so I think that makes us really nervous. If the past is any teacher, we expect that we'll see deaths begin to climb too in the next week or two, which is really unfortunate. What makes that even worse, if you can think of a way to make that worse, is that most of our hospitalizations appear to be among people who are unvaccinated. And so we feel like those were preventable. You know, those were failures on our part to reach people and vaccinate people that may have prevented this from happening to them. The hospitals report that more than 95% of people who've been hospitalized over the past couple of weeks are unvaccinated. We are beginning to see some breakthrough infections as well. Some people who are fully vaccinated are also getting infected. That's completely expected. As you know, these vaccines are on the order of 90% effective or so, perhaps a little less with Delta, perhaps a little more with the original strains. but on the order of 90% effective or so. So about 10% of people who were fully vaccinated would be expected to get infected if they were exposed. We see lower rates of hospitalizations and lower rates of death, however, among those people who are vaccinated, even when they have breakthrough infection. So the vaccine, even when it doesn't prevent infection, does seem to protect against hospitalization and serious illness and death, which is really what we would expect. So again, the real tragedy, to compound all the other tragedies of the last year and a half, is that most of the cases and hospitalizations we're seeing now ought to be preventable by vaccination. As all of you on this call know, the vaccine products we have are effective and for the most part against all the variants that we know about. And so it's just our job to get more vaccine out there. Right now, we've vaccinated just under 1.8 million people, just under 1.9 million people total with at least one shot. We're just under 1.6 million people who've been fully vaccinated so far. We feel pretty good about the fact that most of our seniors are vaccinated. In the people over age 65 in our state, or a little more than 75% of them were vaccinated. That's not as good as a lot of other states. But we are proud to have reached that number. Our nursing home residents who are particularly vulnerable, we vaccinated about 90% of them, a little over 90% of them, which actually is quite a significant accomplishment for our nursing homes. We appreciate partnering with them on that. So we are worried about schools. Schools are opening soon. As you know, Dr. Kimberlin is the expert on that, and you're going to hear a lot more from him on that. We have gotten new guidance from CDC about universal masking in schools that is equivalent to what the American Academy of Pediatrics says as well. ADPH endorses that. That's part of our school toolkit that we're publishing hopefully tomorrow or maybe early next week. But we certainly agree that that's the safest way for schools to reopen. So I'll just pause right there. Dr. Arora, that was just a few comments I jotted down, and happy to answer questions now or move on to Dr. Kimberlin, whatever you would like.
Thank you. That was great. Can we just have an update maybe from you, Dr. Kimberlin, and then after that we can do the questions as they start coming in. So Dr. Kimberlin.
Dr. Arora, thank you very much for the opportunity to be joining y'all this afternoon. And I'm delighted to be able to interface with so many people across the state. You know, I think from my standpoint, we heard a lot of data that Dr. Harris just provided. And I suppose what I would like to do is to put faces on that. You know, these folks that are being infected now, overwhelmingly hospitalized, and those dying overwhelmingly are unvaccinated. But with the Delta variant really surging through our communities, and you know, now with the overwhelming majority of the viral isolates for SARS-CoV-2, the virus that causes COVID, in the state of Alabama being the Delta variant, we really are at a different place in this pandemic than we've been before. And it is not a good place. This is up through, February, March, 600,000 Americans had died. And as you heard from Dr. Harris, the rate of increase was slower than what we're seeing now. Now, the Delta variant may, we think anyway, be not more lethal than the more standard variants or the old school COVID viruses that we had last year and that we had in the wintertime as well. But they are so much easier to spread between people. They will have a Delta variant infected person will have 1,000 times more virus in their nose compared with somebody infected with COVID with the original strain of COVID last, May or April or March of 2020. 1,000 times more virus in the nose. And that's why they spread so much more easily. That this virus, all viruses, all living organisms are looking for a way to adapt to give them a survival advantage. And when it comes to a virus, the survival advantage is to be able to spread to other people more easily, and that is what the Delta variant has learned to do very well. It can, because it has such rapid increase in the amount of virus in the nose, By the time a person's immune system who's been vaccinated gets it under control, they've already had the opportunity to pass it to someone else. And that's with someone with some immunity because they've been vaccinated. If someone has not been vaccinated, they're hit with a sledgehammer of Delta virus, and it's creating a lot of problems, hence the rapid increase in cases that Dr. Harris was citing before. We're seeing it some in children, and I really, I'm scared. I was uncomfortable last year. I am scared right now for what lies in front of us with respect to our children. We are facing as they say, an unprecedented period of this pandemic. Now, the good news is that we have knowledge and we have tools to be able to get our way through this. The tool is vaccination. We need to get more people vaccinated. I think Dr. Harris was humble in the way he said it, that he is using his words, we need to get the product out to more people. I'm going to be a little more critical. I think the product is out there for a whole lot of Alabamians, and yet some folks the majority of Alabamians are not getting it. And that's not the way I think Alabama likes to treat our neighbors. We are a faith-focused state, and it's a wonderful state to live in. And much of what is sort of the guiding principle in the state of Alabama is the golden rule, do unto others as you would have them do unto you. Well, you wouldn't want somebody, to live by the golden rule. You don't go up and stab somebody else because you wouldn't want them to stab you. This virus and the decision to get vaccinated, it's not stabbing somebody else, but it is different than the personal decision, for instance, to not take your blood pressure medicine. If you make that decision, you had hypertension, high blood pressure, you don't take your blood pressure medicine, you have a stroke, you're the one that pays the price, you and your family, but you're the one that pays the price. If you don't get vaccinated and you get the Delta strain and you spread it to 6 or 8 other people, some of those people may die from that. Infectious diseases, highly hyper-infectious diseases like the Delta variant of SARS-CoV-2, the COVID virus, that is something that is not just within the person making the personal decision on the vaccine. That is something that person's decision will have an impact on the surrounding community. And I think we've got to get that word out there. The other thing, so that's vaccination, that's our tool. The other thing is knowledge. What did we know that kept things from getting horribly bad? They just stayed really bad in the winter. Well, that's masking. We need to put masks back on, as the CDC has said, and as the AAP and CDC have both said with respect to schools. Everyone, vaccinated or not, needs to be masked inside because we need to decrease the likelihood of the spread of this. That's so between vaccination and masking, I think we can get to the other side of this, but we got to start fast because this virus has a head start on us.
That was a somber update. Thank you for that. I think now, I just, first of all, want to find out about how many patients are in Children's Hospital right now that are with the virus. We had a question on that just now. I don't know if either of you have the ability to answer that.
Well, I intended to look at our dashboard all through the day today, but it's been the COVID's back in terms of controlling my life, and I've not had a chance to do that. So I do not have a number that I can report. I don't know, Dr. Harris, if the state knows that specific number or not.
Yeah, so we get that reported to us voluntarily by hospitals. We don't always have it all the time. About 3 days ago, we had, I think, 32 pediatric patients around the state, including one infant that were hospitalized. I haven't seen a number in the last couple of days, but we've had more. We've had a couple of dozen at least for most of the last week and a half, almost 2 weeks now.
I think some of the concern for why that was being asked was looking at some of the states where Oklahoma, I believe, they don't have beds, and there are patients that are apparently going to Texas. So
yeah, and Arkansas Children's Hospital, was the reports were out yesterday in the regular press about they're inundated. They have many more patients right now than they had in the peak of winter. And that does not bode well. They have had the Delta variant circulating for a longer period of time than we have. that is our future unless we do something really important now. Again, get vaccinated and put a mask on when you're inside.
Dr. Harris, any comments regarding, right now we're the highest state % positivity in the country?
Well, I don't think you can miss the fact that we're also the lowest vaccinated state percentage-wise in the country. I mean, that's an easy correlation. I guess correlation doesn't always mean causation, right? We all learn that, except in this case, I think it does. I think when you have lots of people who are vaccinated, you're not going to be able to achieve that % positivity. Look, we've got to do a better job. Vaccine hesitancy or vaccine resistance, or whatever you want to call it, it comes in a lot of different flavors. There's a lot of different reasons people choose not to get vaccinated. Some of those are really good, smart reasons, or at least questions that people are asking, and they just don't know where to get the answers. In Alabama, we have a lot of people with access to care problems. People, who maybe they've never had insurance, they don't have a family doctor or a pediatrician. If they have a really good, smart question about, is this right for me or my kids, they just don't have anybody to call. They've never, had a relationship with a doctor to ask. Whereas, most of us who grew up with health insurance, we can just make a 5-minute phone call and ask a question and get our questions answered. And so I think we have to remember that there are plenty of people out there who are just waiting, to get the right information. But at the same time, we also have people that are just on the fence. They have information, they're just not sure what to do. There's a lot of misinformation out there. There's some active disinformation campaigns that are going on out there as well, as you know. And so we're trying to meet these people sort of one at a time. We know that for people who don't always trust the messages they get from state government or public health, or who don't trust the messages they hear in the media or from politicians, we know that most people say that the person they trust the most is their own family doctor or their own healthcare professional, wherever they go to get their care. Somebody that has a personal relationship with them, somebody that knows them and their family, somebody who's been there for them before when they've been sick or when they've had questions about their health. And so I think that's why it's so important to have Alabama physicians and other healthcare providers in the state as well to really recognize they're the sources of trusted information that people are going to be looking for.
Yeah, Dr. Kimberlin, so a lot of people in the state seem to have the concerns about the myocarditis once you are considering getting these vaccinations. But can you speak to the COVID cases that you have seen in the year that we have already been through, and the COVID associated myocarditis that is also a possibility?
Yes, I'm happy to do so. The myocarditis issue that I think your question is getting at is an illustration of just how phenomenal our vaccine adverse event tracking system is in this country. And I mean, really, this is the proverbial needle in a haystack. This thing is exceedingly rare following second dose of one of the mRNA vaccines. And yet we were able to detect the signal, we being the CDC and the FDA, were being able to detect the signal and really try to begin to understand it in very close to real time from when it was first being reported with a few small case series. So the CDC has been looking at this, and as your question gets at, it's also assessing it in proportion to or relation to what is likely to happen with wild type disease, in other words, getting COVID disease. It's a fascinating virus, which is probably not a good thing for a virologist to say, but it really is. When you get infected with COVID, there is a lot of inflammation in your body. A lot of cytokines, a lot of other kinds of inflammatory markers that are going up and up and up. And that includes an effect, or has an effect, on the heart itself. So you can have, basically difficulty, almost a shock heart kind of thing, where you just have a difficult time with your heart functioning as well as it is, because your body's overwhelmed with the virus. I mean, you've got truckloads of spike protein all through your body and other parts of the virus as well. and it's impacting your heart, and there can be long-term consequences from that. Just like there can be long-term consequences on the lungs, there can be long-term consequences on cognition and on thinking and on sort of neurologic kind of things. This is a virus that, you know, it impacts the entire body. So that's point number one. It is common to have cardiac involvement with COVID disease, and then specific to the pediatric population, this hyperinflammatory post-COVID condition called MISC, multisystem inflammatory syndrome in children, MISC. This is something that happens in children a lot of times who are asymptomatically infected. You don't realize they ever had the COVID virus. And about 3 or 4 weeks later, they have this hyperinflammatory response, and that as well can impact the heart. So the effects on the heart of the virus itself are real, and they are common, and they can be long lasting. The impact on the heart from the vaccine is exceedingly rare. It is quite mild. When patients are admitted to the hospital, they're in for like 2 days. They might get some ibuprofen in terms of treatment. And from what we know right now in terms of follow-up, there does not seem to be lasting effects. So, and I'm not completely convinced it's a myocarditis, which means, inflammation of the heart. A lot of the patients, and these are generally, kind of adolescents and younger adults, many times more male than female, they will, like I have a friend out in California, for instance, whose son had it, and he rides horses. And it was that when he was riding a horse, it was the jostling on the horse that would cause the pain. That sounds more like a pericarditis to me, like a inflammation around the heart, not the heart muscle itself. And pericarditis generally is even less concerning than myocarditis. So I think we have a lot to learn with it. I do think the most important 2 take-home points are, number one, it happens more commonly with the virus itself. And number 2, when it happens with the vaccine, it's very rare to have that happen, and it's mild when it does. And to use an analogy that, or a comparison that's not the most correct to use, but the likelihood of it happening within the first 21 days after dose 2 of mRNA is like 1 in 30,000. The likelihood of being struck by lightning in your lifetime is 1 in 15,000. You are twice as likely to be struck by lightning in your lifetime than you are to get, if you're an adolescent or a young adult male, to get myocarditis. And if you do get it from the vaccine, and if you do get it, it's going to go away fine.
Yeah, that's a great explanation. To the people that are wondering, why are we targeting vaccinating under the age of 20? Because there are a lot of people who believe that we should be targeting 20 and over. How would either of you address that concern that we are, risk benefit ratio for children and the long-term consequences of COVID?
If I can jump in, I want to give you a public health response, and Dr. Kimberlin will give you a better response than I will. I actually had a conversation this morning with a person who's about 20 or 21 years old, who's a college athlete here in the state, and you might even know who he was if I said his name. But he's a college athlete, and he said, I believe everything you're saying about the safety of the vaccine. It sounds like it's really safe. It sounds like, the risk is really, really minimal. But I'm not going to get sick if I get COVID. So why should I have any risk at all? Why should I even take a chance of that really, really tiny risk of the vaccine when my other choice is I'm not going to have any risk at all? And so what I explained to him was I tried to explain, not as well as Dr. Kimberlin did, but what David just said, which is, first of all, there is some risk of getting COVID, even in that age group. We certainly have had hospitalized pediatric patients and young adults, as I just mentioned to you a minute ago. We've had deaths in that age group. Not a lot of them, but deaths even in people without underlying health problems. We have had normal health, seemingly healthy as far as we know, teenagers or young adults who have died from COVID. So that certainly has happened and has not, to my knowledge, happened in this state with vaccination. But I think the other point that, as a public health person, I'd like to make is that we know with Delta variant, generally speaking, if you do get infected with COVID, you're going to give that to 3 or 4 other people based on the numbers that we have right now, maybe even 4 or 5 other people. That seems to be the the rate at which this disease is being transmitted. So, who are those people going to be? I told this young person today, it might be, one of your college athlete friends, and that person might do okay as well. But, it might not be, it might be your own parent or your grandparent. We know that breakthrough infections can happen. So even if they're vaccinated, it's possible you could give it to them. It might be somebody that you're next to in a restaurant or somebody you encounter at the grocery store that you don't even know. There are, plenty of children, everyone under age 12 who don't even have the opportunity to be vaccinated. And it might be your younger brother or your younger sister that you give it to. So we would hope people would understand that it's not only about the risk to them, although it is about the risk to them, but it's also about the risk that they could pose for other people.
Yeah, and I would add, I'm one of two liaisons from the American Academy of Pediatrics to the CDC's Advisory Committee on Immunization Practices. So I've been at, well, I guess the Zoom table for the last year and a half on all things COVID as it relates to vaccines, and so when we talked about at the May meeting with an authorization recommendation to go down to 12 years of age so that we would end up for the Pfizer vaccine 12 through 17. So they showed data in terms of what the real disease impact is for the adolescent population and the pediatric population. COVID in 2020 was the 10th leading cause of death in children in the United States. I'll say it again, COVID in the United States, 2020, the 10th leading cause of death. Now, if you look at 600,000 Americans, and of those 350-ish are children who die. Yeah, the raw numbers are not comparable. The older adults were the ones with at least the prior to the Delta variant, the ones who were hit the hardest. But there also is just a true statement: older adults die more than children die. So and there are more older adults than children. 20% of the population or so is pediatric. So there is a disparity in the numbers to begin with. I think it's important to keep track within the pediatric population. How bad is it? And to me, as a parent of 3 young adults now, to me, 10th leading cause of death, that doesn't sound real good. The other thing I want to mention, it's a personal, well, 2 personal things, I guess. One is I was on service in January, February, and March, and I gowned up and went into the ICU beds. I was there when one patient was put on ECMO who was 16 years old. This is not a benign disease. I can promise you that. And I promise you by looking through my face shield, which was kind of fogged up because of my N95 mask and my other mask on top of that, looking into the eyes of the parents and the grief that they were experiencing at that time, that was in the spring and winter. That was before we had the opportunity to prevent this with vaccines. Another thing that was before the opportunity to prevent it, but it really drives home, I think, the message that Scott was making about the impact of somebody getting the virus and giving it to someone else, which relates back to my, Good Samaritan or golden rule kind of thing, I should say, that I mentioned before about doing unto others as you would have them do unto you. My father and mother are in a long-term care facility over in Texas. And in November, my father, who is 92 years old, acquired COVID from one of the people working in that long-term care facility. This was before vaccine. She didn't have a chance to avoid that, at least from vaccination. But nevertheless, it got in and he was dead in 5 days. The fortunate thing for my family, my mom was asymptomatically infected. So at least unlike most of the other 600,000 families, she was at his bedside holding his hand when he died. But what we do has real consequence on others when it comes to a highly infectious disease, a respiratory infectious disease.
So, there are a lot of questions, multitude of questions right now coming from parents who are extremely concerned about starting schools. They don't know what to do. They are feeling very helpless. Hearing all of this and knowing where our trajectory is as a state, which couldn't be worse, really. What can they do is what they're asking. What can they do? to make their schools be able to mask for the children, not just their children, all children, to prevent the spread of COVID. I think they understand now the seriousness, but some of them are feeling helpless.
Well, I'll jump in at first. It can get worse. And I am really scared, not fearful, scared that it will get worse. It's kind of getting worse at a bad time, isn't it? I mean, you know, we got school starting soon. We know from last year and the spring of, you know, the 2019-2020 school year as well. We know now that children and adolescents need to be in school. They need to be in-person learning. There are major, what at the time were unforeseen consequences of not being in person: educational consequences, socialization consequences, you know, nutritional consequences, physical health consequences, certainly mental health consequences of doing things remotely. And so, you know, we, the American Academy of Pediatrics, you know, I think Scott will speak to the state, we CDC, we need parents, we need our children and our teenagers in school, in person, in school. I would suggest the following. These are three things to do. One, if your child or adolescent is 12 or over, get them four things. Get them vaccinated. Number two, tell everyone you know that you got them vaccinated. And because Scott's right. I mean, the doctors are tremendously influential, but I don't want to downplay the influence that colleagues and friends and neighbors and family members can have. Don't go in there and you need to do this. Go in there and say, look, I care about you. I've known your child since he was, you know, playing, you know, t-ball, and I care about what happens to him. Please get him vaccinated. This Delta strain, I promise you guys, this Delta strain is different, and it is bad. We are standing in a tunnel right now, and the train is accelerating at us as we speak. So number three, mask indoors, and everyone at school should be masked. Then number four is one maybe you weren't thinking that I would say. Call your superintendent and call your school principal and tell them how uncomfortable you are, and tell them that you want everyone masked, because there's a lot of people out there that have true misinformation on what masking does. People say that it suffocates people. It does not suffocate anybody. And they're out there spreading it, and they're loud and they're mad. And so the superintendent and the principal and the teachers, they hear those loud, mad voices. We need to present loving, concerned voices. We are the majority. I am convinced of that. And we need to make sure that the leadership of our schools realize that we are concerned about it as parents. And that is over time. If enough voices do that, we're in a democracy that will influence policy. And that's what we need right now. The immediate thing in front of us is vaccinate, mask, and tell everybody about it, and talk with the people who are making the decisions for your particular school, and tell them how concerned you are.
Well, I really appreciate both of you. I think we have had some great messages here today and questions answered. I'm going to allow each of you an opportunity to say anything if there's something left to say. Dr. Harris?
Sure, thank you. This is actually such a great forum. I know it's really hard to see every single question and answer them, but Dr. Arora is doing a great job going through those, and I certainly hope we've been able to cover at least the major topics that people want to talk about. I do want to say not to be gloom and doom, but just to be honest with you, I think we have some tough months ahead. I think Alabama has numbers going in the wrong way. I don't think we're anywhere near the critical mass of immunized people we need to have. And I think we need to be ready for that. It's certainly true, as Dr. Kimberlin said, reaching out to your public officials, especially your local ones that you know in your community, is helpful. They need to hear your voice. I think the people who are rational and understand science and who just want to do the right thing, we really are in the majority. We really are. but we're not always the most vocal people. And so I would 100% agree with everything he said there. If you have questions about information about what's right for you, what decision should you make for your kids, whether it's vaccinating or anything else, please talk to your doctor. Please pick up the phone and call that person and ask them. We know not everybody has a doctor. Please talk to us at Public Health. That's what we're there for, and we can absolutely answer those questions for you or get you to the person who can. So thanks again for joining us. I'm going to pass it off to Dr. Kimberlin, but just to remind you, we're going to be here again next week with other types of questions and other types of discussions, and we just appreciate you all making time today.
Well, I appreciate the opportunity to be with you this week. I am doom and gloom, and I think we're facing a catastrophe. I also think we have the tools to avoid that. And we've talked about those over the last half hour or so. I had 2 lengthy conversations with a woman in northeastern Alabama last week who was not vaccinated, and her husband's not vaccinated, and they both have high risk conditions. And she had very willingly, not gotten the vaccine. And I don't know that I changed her mind after the first 45-minute or so conversation. I will tell you this: she was leaning in, she was making excellent eye contact, and she asked really good questions. And I tried to give her the answers, honest answers, including saying when I don't know something. We don't know everything, and we shouldn't pretend that we do. It followed the next day with her request to run a few more questions by me, and her husband had sent some questions with her. I think all we can, and as I say, I sat down again, we had more conversations, and I hope and I pray that she will get vaccinated. And I told her that. I said, please, do it for me. I mean, do it, just do it. And it may have made a difference. It may not have. What we can do, though, is each of us do our part. And our part is to tell our stories and to tell people why they matter to us and how we care about them, not with shaking of fingers. That is the surest way to get my back up. And I'm not going to listen to somebody if I feel that they're coming at me. But to do it by just telling your story and why you care about what happens with them. If they get vaccinated, if we wear our masks inside, we're going to have a bad few months, but it's not going to be the catastrophe that I fear. If we delay, we're going to be like we were in March 2020, where literally waiting 2 weeks cost about 100,000 lives. We've got to do it. That's nationally, not in the state, but nationally. We've got to move now. Now's the time to do it. I think this forum's a great way to kick it off. And I hope folks out there will contemplate and reflect on what we've talked about and reach out with questions and hopefully make some good decisions.
Well, thank you both very much, Dr. Kimberlin, Dr. Harris. As the Medical Association for the state of Alabama, one of our mission roles is to advocate for the public, and we hope to continue to do this weekly. Thank you.
Thanks.